I'm Professor Pieter Kruger. I'm a consultant clinical psychologist and the director of the Center for Health and Human Performance at Northwest University. And today we are talking to my colleague, Dr Rümando Kok, who's a senior clinical psychologist and also the clinical lead in our practice. Now, Rümando is an experienced senior clinical psychologist working with individuals, couples and families. And today we're going to draw on his experience more of working in the field of couples and family therapy. Rümando, maybe just to kick things off, what does couples therapy and family therapy entail?
Okay, yeah, when you think about couples therapy, you're working with the couple as a system. So we refer to that as being a dyad. It's a two-person relational system. When you add then working with a family, then you're working with several different dyads. It's no longer just the couple as a dyad. So if you think about that, let's say there's a child, then you have a relational system between the two parents, but before that, obviously, a romantic system. And then if the children are there, then you have different relationships between the parents then, as a relational system, but also as parents, and also a relationship between the child and each one of the parents. So it would be the father-child relationship, mother-child relationship. So it's quite an interesting dynamic then to focus on. So basically, if you work with couples and families, you're working with interpersonal relationship dynamics. And your understanding of that to determine if the system functions effectively or not. And often that's where we get the referrals, when the systems are not functioning effectively.
On that note, can you tell us a bit more about some of the common reasons why people would come for a couples or a family therapy process?
Yes, if I think about the application forms that I've received over the last couple of years, I think one of the main problems would be conflict. So conflict is typically when they become reactive instead of interactive, or where there's a sense of being reflexive instead of being reflective. That's something we find often. Another issue might be marital difficulties, relational difficulties. Sometimes there's infidelity, extramarital affairs. You have to deal with that. Sometimes it's dealing with divorce, how to navigate that whole process. So there's different reasons. If we boil it down into I call it the basic building blocks of family functioning, the issues center around problem solving. It's as though as individuals they can solve problems, but shared problem solving is difficult. They're not on the same page. Issues in terms of communication. So it's as though communication becomes indirect or vague, and then you tend to miss each other. There's often issues in terms of roles, so either role clarification or role definitions, and we need to have some built-in role accountability, knowing who's responsible for what by when. So people just sort of assume, you are responsible for that, you will do this, but it's very seldom spoken. It's implicit, it's not made explicit, and that can be a big source of conflict and tension within a family. Emotional attunement is another issue. There's a sense of emotional disengagement, detachment, or a disconnection. So the family can function well in terms of practical aspects. They can, do the daily things, drop the kids off at school, buy the groceries, but the ability to deal with emotional content in the family can create a bit of an issue.
I can imagine, but one question I want to ask is, with individual therapy, it's easy. It's the person who wants to come in and you help them. I assume there must be various levels of motivation if people come in that not everybody wants to be there equally. How do you deal with something like that if you can clearly see one person is more motivated than the other?
Yeah, that's a tricky situation working with a family. So what we often do working with couples and families is you branch it off into individual processes as well. So, you might start off seeing the couple, and then it's quite clear that there's a need, it won't be in the best interest of this couple to continue working with them as a system. And then you move into individual sessions. You might then either stop or pause for a moment, the joint sessions, having individual sessions, and then you can always go back to joint sessions. So you have to use your judgment there on a case-by-case basis.
Which I can imagine can be tricky at times. Based on your experience, having done this for a very long time, what are some of the main themes or dynamics that are addressed during these couples or family therapy sessions?
I think linking back to the main problems, conflict would be one, obviously for various reasons. The second one, I think, has to do with power dynamics. you quite often find a bit of a power struggle. So we often refer to the one up, one down, or equal position. One up being wanting to take the lead, one down being a follower, and equals where you have a shared distribution of power. And if you find family members who are rigid, meaning that they stick to one position, I just want to be in the one up position, that can create quite a problem. So healthy functional individuals can function in all three of those power dynamic positions. You know when you need to be in the one up, you can also be in the one down, and you can be equals. So I often find that that's quite a challenge for some people to be able to move into those different power dynamic positions.
Would you spend time with individuals as well, and not just the couple together then, to make sure that you deal with some of these identified challenges?
Most definitely. It's at times it's indicated, it's necessary. So you have to move into individual processes to deal with that. The issue is in narrative therapy we refer to that as a dominant story. So the dominant story characterizes your life.
Yes.
So the risk is that that dominant story just keeps on playing out in the couples or family sessions, and therefore it's at times necessary to move into individual therapy sessions so that you can look for, we call it the unique outcomes or the exceptions, which is the alternative story. And if you sort of try and emphasize and focus on the alternative story, then you can move back into the joint sessions.
Is it different if you do individual therapy with somebody who struggles in a relationship versus working with a couple?
That's an interesting one. Murray Bowen said that you can do family therapy just working with the individual.
Okay.
So a big part of couples and family therapy is strategic thinking. So you're like a secret agent, you always have a plan. And at times, let's say the system is not open to come for couples or family sessions, you can also then indirectly, you directly work with the client, but indirectly you work with the whole system. So you can do family therapy just working with an individual.
Very interesting. Maybe a last question, and usually people like some practical advice. Do you have any recommendations to give people that might benefit them as couples or as families, being proactive and maybe avoiding having to necessarily end up in a formal process?
I think there's a long list. I can give you a couple maybe now. I think the one thing that I pick up a lot is people measure themselves against perfection. So the idea is being a perfect partner, being a perfect parent. So it's impossible to be perfect in an imperfect world, in a broken world. So it's about what you measure yourself against. You have to measure yourself against being good enough. We have our limitations. It's about accepting the limitations and doing the best we have with what we got. So I think it's quite a reflective exercise to just change that from perfect to good enough. That already helps a lot, takes off a lot of pressure, and decreases disappointment. So that's one piece of advice. Maybe the next one is to be direct and clear in communication. Be careful of assumptions.
Yes.
A lot of that comes out in couples and family therapy sessions, and a lot of these assumptions are incorrect. So be direct and clear. If you wonder about something, ask. Don't just assume and act according to your assumptions. So that would be a second piece of advice. Spending quality time together, be it the couple or the family. And quality time is it's obviously not the quantity, it's not the amount of time, but what you do in the time that you have. So you don't need to spend a lot of time together, but the time that you do spend, make it count. I think life is busy and fast-paced, so people need to optimize the quality of it. And spending time together is not sitting in front of the TV. It's being around the table, having a meal and being in conversation, being outside playing with your kids with a ball, something like that. That is quality time. So I think that is important. We have to also then think about nurturing and nourishing our relationships. Relationships are so crucial. And just thinking about how much time we spend on making sure that that is of high quality. That would be some of the pieces of advice.
And maybe a last question, just for the sake of interest. Do you find a difference in, when it comes to couples therapy, the age category of people who come to see you? Is it more young couples? Is it older people? Or
that's an interesting.
What do you experience there?
That's an interesting one, because my experience is it's across the board, but the difference is in terms of emphasis. There's a lot of younger couples, but they tend to present with more a preventative focus, sort of preparation for a marriage. They want to do a bit of work before getting married. They want to identify things that might be an issue in a marital system. So it's more a preventative focus, which I think is really wonderful. But then moving through the spectrum, different ages, as you go along, you find the focus not being so much on prevention, then the issues are already there and it's been there for numerous years, and then you have to deal with that. So it is across the spectrum, but for different reasons. Obviously, you get younger couples where you also find issues that they have to deal with, but I quite like the preventative focus, almost an investment in the marriage.
Is it a young generational kind of mindset, do you think, to do more of that?
It seems like it to me. It seems as though the shift, it might be that some of the stigma has been addressed and they don't view this as you have to have an issue to go to therapy. They also understand the fact that we can work with strengths and further enhance
Excellent.
what you have.
Well, there you have it. So whether it's relationship challenges or challenges within the family, you don't have to suffer in silence or by yourself. Please feel free to get in touch with the CHHP if there are any particular needs on this front. And hopefully this would have given some insight into how couples and family therapy can be of assistance. Thank you very much, and join us again for some of the future talks to come.